Hi, everyone, and welcome to a new podcast, Shades of Black. I am your co-host, Nérolane, the founder of Consciously Black, a community platform where I gather Black individuals in Canada to discuss their Black experiences and revive Black pride.
And I'm Miriam, a registered psychotherapist and founder of Thoughtful Therapist, a mental health platform aimed to empower marginalized communities. And together we have created Shades of Black, a bi-weekly podcast emerging from both our studies where we shed light on the different experiences encountered within our Black communities and the mental health aspects that exist within those experiences.
Join our new community space where we discuss our challenges, our successes, our joy, our pain, and our Blackness. Follow us on YouTube, Apple Podcasts, Spotify, and all other platforms to tune into our bi-weekly episodes. We cannot wait to converse with you. Hi everyone, welcome back to another episode of Shades of Black. I am your co-host Nérolane.
And I am Miriam. And today we will be having a little different conversation today. So we have two special guests with us, and we have Aurore and we have Anicia, and they'll both be giving us a different perspective on the nursing field, but one coming from a South African perspective and one coming from a Canadian perspective. So Aurore will be speaking on the South African perspective and Anicia from the Canadian perspective. I think our intention today is to kind of just see what the healthcare system looks like for us, being Black women working in the system, and drawing some similarities and differences from these two perspectives, seeing some similar colonial history having there and its impacts on the healthcare system. So let's dive in.
Yeah.
Aurore or Anicia, I don't know who wants to start to introduce themselves.
I'll start. Hi, I'm Anicia. I'm Haitian. I'm half Haitian, half Nigerian. I am a registered nurse. So I've been a nurse for 14 years. I'm a mom, and yeah.
Okay, that's me. My name is Aurora, and I am from Rwanda, but I grew up in South Africa. So I would say I know a lot more about South Africa. And I'm currently a nursing student at Algonquin College. I'm doing practical nursing. And I was also a nursing student in South Africa. So unfortunately, I never graduated. I was close to graduating, but I never graduated. But as a nursing student, you work in the different hospitals and clinics and you get some exposure. So I guess I'll be speaking from that perspective today.
That's good. That's good. Thank you. Okay. So then I guess we can start with seeing how you guys got started on your nursing journey, what got you there, what got you started, motivation, and all that fun stuff. So Anicia or Aurore,
Yeah, well, that takes me way back. Nursing wasn't exactly my first choice.
Yeah.
I really wanted to do medicine, anything in the medicine field, as growing up Haitian, education and medicine were, the top thing to do. Mm-hmm. Didn't really have a choice. I don't know. My mom really wanted me to do nursing. And in my three choices for university, I didn't know what to do for my third choice. So I went with nursing. And of course, I was accepted in all three. And I don't know. Fear came in and I decided to go with nursing.
So what was the other three options?
I believe I did health sciences and physiotherapy.
Okay, nice. Still within health.
Yes, I really wanted to be in medicine.
Okay.
I was hoping at the time to be able to go to medical school.
Okay. So what stopped you? Just curious.
Fear.
Okay.
Fear. Yeah. The fear was real, right? Like, hearing my parents talk and seeing what's going on in the world, right? Like, nursing was really a safe bet, right? Mm-hmm. And it was, you graduate, you get a job.
Yeah.
It wasn't, you have to wait. If somebody likes you, if they don't like you, you won't get promoted. The other person, and it was, I had to pay for my college degree. So it was, I don't want to work and have to pay all these debts or whatnot. And, I graduate. Okay, I have a degree in arts, and this is great. What am I going to do now, right?
Yeah.
I can't feed myself. I can't help my family. So, yeah, it was definitely a tough choice, but...
How has it been so far? Have you enjoyed it? Like,
Oh, definitely.
Yeah.
Definitely. There's always, it's ups and downs, right? But no, I definitely don't regret nursing. It definitely opens up lots of doors, right? So that's always good. Yeah.
And which like departments have you worked in?
I've done a few. Like I've started off in like labor and delivery. I did mental health. I worked in ICU. Yeah.
Okay. Good.
I worked in long-term care.
Okay.
Yeah.
That could be another conversation.
Yeah.
Okay. Okay. What about you?
Right. So, again, my one was not nursing first. My first choice was law at school. So I actually wanted to do law, and nursing was my second option. So I was so sure I was going to get into law that I didn't really know that much about nursing. I just thought, okay, I'm not gonna go so deep into it, but I know my parents also wanted me to get into nursing, just because first of all, it's important to have that knowledge to help yourself in any situation, and at the same time, you're definitely going to find a job. It's definitely gonna protect you, and also in South Africa, it's very difficult to find a job. So, you're gonna do a job that you're gonna study something that you're gonna get a job in. So I was prompted to make that my second choice, but it's not like I hated it, just didn't know much about it. So I didn't get in for law, so I was able to get in for nursing instead, and so that's how I ended up doing nursing. I ended up loving it to some extent during the time I was studying it, but generally that's how I got introduced to nursing. So it was another option of mine, and got introduced in it, and just decided to continue afterwards, because you never stop being a nurse, even if you stop studying it, because you know stuff. So
It's
you
true.
can't
That's
unknow
true.
that stuff.
That's true.
Yeah.
Why do you think nursing or anything related to health is so important within the Black community?
Especially, I guess, for Black women specifically, because you do see us being more predominantly within those spaces.
Yeah.
So yeah.
That's a good question. Yeah, it has a lot to do with education, first of all. They just, if anything in the medical field, they assume that you're very well educated and that you know what you're talking about, and it's considered respectable and helpful, and it's something important. It's a value, right?
Yeah.
So it's very important in our culture, all those things, right? Respect, value, honor, right?
So I guess like medicine is at the top there.
Yeah. It's at the top.
Okay.
And of course money. Yeah. Talk about money, right? Right. So, and in Canada, being an immigrant from any country, it's a guaranteed way to make money, right?
Yeah.
So where there is less discrimination towards you directly, right?
Okay.
Less,
Quote unquote less.
yes, quote unquote less,
Yeah.
right? Because nursing is a regulated profession. So one of the things that is going to make a little bit less discrimination is that you're on a payroll. Yeah. So your coworker is making the same amount as you, right? Like it's
At least you're hoping.
No, you're not. This is not. You can't be doing the same job, and
That's
then
true.
this one's making. In lots of other corporate jobs, it's not rare that your coworker who's doing the same job as you is getting paid more, right? And you don't have to fight for your salary every year, right? Like I need a pay increase. You're on a payroll, so whatever every year until that scale is finished, financially you go up. You don't have to make your case or prove your value every time, right? Whenever you're working with a private company or any other corporate jobs, right? It's always every year, you have to show them, prove that you're of value, right? So
Interesting. Okay.
I think.
So I guess it would be security and the value that it brings, especially being an immigrant person coming into Canada and knowing that you're already going to face so many challenges, so you might as well just secure something that's gonna show people that you're of value, that you can contribute, because automatically people will just kind of see you as black and maybe see you as less than.
Exactly.
Yeah. Okay.
So the security is definitely like the priority, right?
Yeah.
Like
Yeah.
you will eat.
Yeah. That's true.
You will get a job somewhere.
Yeah.
You might not like it, you might not want it, but you will have a job.
That's true. And thinking about security too, like a lot of us leave our countries for lack of security. So you want to make sure that you're not going to have to face the same issues coming into a new country. Yeah.
It is.
I think that I totally agree with your point. But the other aspect too, it's not that we have much choice. Growing up in Canada, we can say we have the choice to choose the field that we want, but especially when you're first generation or second generation, like you mentioned, we don't have the same privilege of having a bachelor of art, like you mentioned, and then trying to find a job and trying to find stability, because eventually when you graduate, you do understand, depending of the setting of your family, depending of if your parents do speak the language, the background, you understand that you have to take care of your parents and stuff.
Yes.
So I think that the baggage of cultural, either your second generation, even first or second generation, I feel like they have the same understanding of they have to take care of the parents, the grandparents. Like there's a lot burden on their shoulder and stuff. And on the other stuff, and the other thing I was thinking is when we think about it, Black women in history has always been caretakers.
Yeah.
I think that's something that we do with pride and we do so well. I don't see any other community, ethnic group that takes so much pride at taking care of their own, but also taking care of others. And that do it in such a respectful way. And also when we think about that, it's once again because they didn't have the choice. That was just what society thought they were able to do, and they put them in this little basket. So even when I think about Haiti too, or any immigrant country, matter of fact, but I can only talk on behalf of Haitian because I Haitian, but women in Haiti, what's your career path going to be? Because you can choose to become a lawyer, you can have other aspiration in life, but unfortunately most of the field is a men field, and in order when you entering those sector, you kind of have like men always in control, and they're always going to reduce you to your sex, your gender. And nursing is the only field that's secure for a woman, and you don't have to compete, you don't have to show that you are capable, like your
They're automatically respected.
So anyways, that's we're gonna go to
No, but that's a good point.
but
though.
yeah, I really feel that anything related to health, we don't have the choice, and it's all to come down to your point is we have to provide, regardless of if we like it, regardless of not, like you just gotta provide. So yeah.
Honestly, I don't have that much to add. You guys literally said everything. Especially because, again, my reason for going to nursing is because of my parents pushing me, because they kind of saw that as this is an important pathway to lead, because you're not just going to do it for you. You're going to be able to support everybody to some extent, whether it's in health or even like just general advice, because you cannot always trust what some doctors are telling you, because you don't know whether they are going to be looking at your problem for real or if they're kind of just disregarding you, So you need someone who you can also go for advice as well. And there's also the universality of nursing, where you can go anywhere in the world, you can find a job. Of course, it's different. They might not give you the same title that you got in a different country, but you're going to not starve. you know, and that is extremely important. That's why, you know, many of us, I think, as Black women, we go into nursing.
Yeah.
Like you guys all said, it's about respect as well. Nobody will be like, oh, you're a nurse and you're a doctor. A nurse and Black, that's not a big problem. But if you're a doctor, they're kind of like, oh, okay, that's really good, but how did you get the money? Or, you know, where did you get the funds? Unless you're coming from a rich person or something, you know.
Question.
Yeah.
You know? But again, I'm not a doctor, so I don't know, but I know that it's there. You know, there is that difference in healthcare as well. You see that, especially like in South Africa, where jobs are scarce. It's very difficult to find work. Even in the nursing field, you find that a lot of people struggle to find a good nursing position because you often reduce to like the basic primary healthcare positions. You know, to get further than that, you have more responsibility, more money often is offered, so it's a bit more scarce, but still it's still needed, right? Because oftentimes you see people leaving a lot, and so they need to replace that as well. That's why you get a lot of like people who are overstaffed, and also to some extent, I think that oftentimes sorry, my mind is...
It's okay.
You find that you have to prove yourself wherever you are, but with nursing, you know these specific things. It's not always abstract. You know the fact, you know exactly what care you're going to give. So even if they question it, you can prove that, listen, this is why I did this, is why I did that. They, you know, won't be able to just get you like that.
Okay.
So for Black women, I think it's a very good thing.
That is some heavy load to carry. And it's true. Like, we have to provide for families, for everything is on the Black woman.
Yes.
Everything. And that is tough.
It is.
I'm wondering though, like, do Black women really want to be in this field though?
I mean, I know many people. Who do
That's
for
a question.
passion.
Yeah,
That's a question.
Yeah, I know many people that have, because again, you're thinking about people who are maybe coming from like impoverished places or poverty, and they see their community and they know that they can do more for the community, but there's no access to this community, or the access or the support that this community must get is not available for them. And they don't have any people in the community to help bring them up. So they're going to do nursing to come and bring it home and kind of educate people and help them, because knowledge is expensive as well. Not everyone has access to that. So it's important for somebody who is knowledgeable to go and teach their own people that, because they can be sustainable on their own. You know what, like oftentimes in South Africa, not everyone can afford medication like that. Obviously you have over-the-counter medication, but then oftentimes we also focus on a lot of home remedies, because some people stay very far away from the hospital. Like if you stay in the village or in very like rural areas, kind of like far away from actual hospitals and stuff, it's difficult to bring your child in to the hospital today or tomorrow. Okay, especially if you're also working, you don't have time to take off. So you have to be able to find home remedies to give to them, and to be able to look after the child until you're able to bring them to the hospital, or to maybe help them get better. So you need that knowledge as well. And people coming from that background, I know they're doing it for passion. I work a lot with a lot of those people, and I realize that maybe I'm coming from a place of privilege because I don't think that far, right? I don't think that my knowledge is also going to be someone else's knowledge tomorrow, and they'll be able to use it and be okay, you know? But then at the same time, because nursing is a very difficult profession, they put a lot of pressure on you, and oftentimes you get the blame for a lot of things, right? If maybe medication has arrived on time, or if there has been a shortage in staff members and the needs are not being served, it's going to be a problem. Because again, I'm speaking from a nursing perspective as a nursing student, but I did nursing for 5 years because I did a foundation course, and then the actual degree is 4 years, but I did an extra year because it wasn't my first, and I didn't do amazing in mathematics, so I didn't get straight into the course. So just like a foundation phase. So we did 5 years instead of 4 years, right? So that time you work in the hospital. So after 3 months, we started working in the hospital, and you working with people. Obviously, you have the registered nurses and the practical and the they say practical nurses here, but in South Africa we call them staff nurses. So they are there, and also the enrolled nursing enrolled nursing assistants, which are kind of PSWs here, right?
Yeah.
Personal support workers. So you have that, but again, there's only like, maybe you'll have one registered nurse and like 2 practical nurses, and then maybe 3 PSWs, right? And then you as a student will be like an enrolled nurse assistant, like a PSW, right? But you're a student, so you actively work in people. You have to wash them. You do everything, right? And then you go to school and you learn about it, but you're working as a nurse. So the person who's coming to a hospital doesn't know that you're a student. You know, because there's designations based on uniform, but they don't know. So you are going to have to provide the service, and you get blamed just as much as anybody else. And if you make a mistake, if you didn't follow your rules and did something out of your scope of practice, like out of your you know, then obviously you're going to be blamed for something, because you put someone's life at risk, because you're taking people's lives here. So you get to know a lot of these things. So I know I wasn't working as a licensed nurse, but I got a lot of that experience. And so that's why I'm just like, nursing is as amazing as it is not amazing. So, yeah.
Would you say the same thing for like nursing students from the Canadian perspective? Like, how big is the load? Because she was a full-time nurse.
I would say the nursing students here are pretty well supported. Yes. They don't let you off on your own too much.
True. And I think it's also because of the amount of people that need help and have access to healthcare. Because South Africa, obviously, the population is bigger. Right? And I was studying in Cape Town, so obviously the population was quite high in the city, and there's only so many people you can help in a day. And there are so many people. And, you know, having a student nurse, even when they're inexperienced, you can help them get there. But oftentimes, any hands that you can get,
it works.
Them, right? Yeah. And you learn very fast. Like, when I started, because now I'm studying here as a practical nursing student, but it's only my like 2nd semester. I don't know much. Just working in long-term care, and I was surprised by how actually little the nursing students do. And it makes sense, because you're being properly watched, and there's not that many people always. But like in South Africa, if you're in a hospital, sometimes it can get up to maybe 40 people in one unit, you know, because there's just so many people that need help, and there's like 6 nurses, you know, because it's short-staffed. So if you have an extra nursing student that obviously within a certain scope of practice, you can help, you know? So
It puts you to work.
They'll put you to work. You're going to wash somebody. You're going to do the basic, you know, helping them eat, those small things, you know? So
like, it's basic needs, I guess, too.
Basic needs, but basic needs can also be complicated if someone has like more serious illnesses. If they damage, they have like, you know, broken bones or anything, you have to have the technique, but still basic.
So I guess question for you regarding South Africa, just to give people, like whoever watching, a bit more perspective of how it is a health system in South Africa. I know you already went to in detail, but for viewers that doesn't know, I mean, I'm sure everybody knows where South Africa is.
I'm hoping.
But a lot of people doesn't know necessarily where does South Africa falls into, if it's considered as developed, a third world. They don't know where South Africa falls.
South Africa is considered South Africa is considered a developing country, right? So not really third world country, but not first world at all. So I would say it has a little bit more resources than some other African countries, in terms of maybe some infrastructure, like medical infrastructure, like more hospitals, a little bit more clinics, and more specialized equipment, you know, for certain things. So I would say it's a developing country. But having said that, though, it depends on where you are situated in South Africa, because of course you won't find a hospital everywhere, right? In the big cities, you will find a lot of hospitals, a lot of clinics, and a lot of resources. Even then, there's obviously short number of staff that is available because of course there's only so many people that can be qualified at a time, you know. And then you get obviously more rural areas where it's a lot more space, but there's a lot less clinics and hospitals. Like the closest hospitals maybe 2-3 hours away, you know, and so that's where you can maybe see some of the clinics and hospitals suffering from resource shortages because they just don't have that same access to the main city and the main delivery lines. I cannot say that I'm an expert in that because I never really worked outside of the city. I never studied outside the city. But we do know that being a student in the city, you know, you had more access to more resources. And I was also studying Cape Town. In Cape Town, I would say that it has a lot more resources. It's a bit more of a little bit, I wouldn't say wealthier province, but it has more wealthier benefactors. So I think that the resources are more accessible, especially if you compare to some out areas, because again, South Africa, there's a large population of people that are in poverty and they don't have that much access, and even they don't have much access to healthcare, and at the same time, even the places they are staying are not that developed, right? They're still being developed, but they are also places where the government has, you know, kind of neglected to push people forward, and so there's not a lot of setup for healthcare and stuff like that. So in those particular clinics and hospitals, there's a lot less resources, and so you will see a lot more staff shortages and also resource shortages, like maybe vaccinations for children, and also maybe like equipment, like, you know, we call them linen savers, but blue sheets you put on the bed.
Oh, the
Like
piqué.
the blue pads, like
Le
the one that prevents someone from dirtying the bed.
Yeah.
Forgot the name.
What do they
now.
call it
So
in English?
horrible. Maybe because
I know in French. I don't know.
blue pads.
Oui, le piqué.
Blue pads, I guess. Damn it, I know the word, but
It's
gone
okay.
now. It's gone now. But yeah, that's pretty much how it is. You see that when you come also to South Africa from other places, you'll see that they have a little bit more free resources, such as condoms. Like some places outside of South Africa, some countries, they don't have condoms readily available for people to take. But a lot of South African medical system, the healthcare kind of focus on prevention, right? Because there's a huge HIV pandemic. I don't know if it's as bad as it is. It definitely has come down over the years, but of course they focus on prevention. So free condoms, you'll find them in the clinics or in as also in hospital, and some places you don't have access to that. And also, if you're having some serious illnesses like HIV, oftentimes you find that medication like ARVs, antiretroviral medication, is given for free. But it also depends on your social background, because some people can afford to pay, so they will go to private healthcare. So you can pay for private healthcare, and you know, you can get that, or you can go through the government system where you get medication from the government, and obviously if you're very poor you cannot pay, so they will give it to you for free. I don't really remember how they determine that, because oftentimes if you go to the clinic, it's usually free, you know, as long as you have the permit and you're a South African citizen, you know, to be in South Africa, you have access to it.
So that it's very similar to what we have also in Canada, which is, I feel like a lot of people probably didn't know about South Africa. So thank you for taking the time to elaborate on that.
Sorry. I was gonna go for Anicia. I was gonna say, like, do you see like any similarities or differences from what she just explained within our system as well here, like working in it? Like she mentioned being short staffed, like we all know.
I think
we all know that exists here.
Yeah, we're definitely short-staffed here too.
They're hiring.
Definitely. Yeah, healthcare is also an issue here. Definitely, it's a work in progress, especially with the whole pandemic. So. Yeah.
What about with like prevention?
Know what our wait times are in Emerge.
Yeah.
So. There is some prevention work being done I'm not too familiar with it. I'm more on the other side of it. Once you're already sick.
Yeah, that's true.
But yeah.
I'm not generalizing anything, but I don't think that Canada has a preventive system and mentality of things.
Not as much as they would like it to be, or they
Yeah.
think that it's implemented.
Yeah, because I feel like, I don't know, the fact that I also work in the government, I do see how, especially with COVID, like the lockdown started in March 2020, but
It should have started way before.
if you work in public health, you kind of already heard of it before.
Yeah, it's true.
There was already case showing up here and there, but there wasn't that preventive side. Maybe it's because they just think that, oh, like Canada would never go through a pandemic. I don't know. They just
Not us.
yeah, not us. That could never be us. Like we're
This first world country.
yeah. and I think that because of that, they just don't have that preventive mindset, or they think they just have all the resource in the world to, when it comes, they can block it
And deal with it.
you know, deal
Yeah.
with it. But COVID taught them differently.
Yeah.
But here we are 2 years after and still talk about COVID.
Yeah.
So
But like even like with me, like being in the mental health field, like I've seen the same thing where like even when I was doing my internships and like I had youth that I had to refer to emergencies, like they were in crisis, but you would send them to the hospital and nothing was really being done, or they would bring them back. Well, I feel like they wait until it's a case where it's obvious crisis,
yeah.
and then they'll admit them, instead of taking the time to actually like assess where the patient is or where the state that they're in and see what they can do now to support them for later.
Prevent the crisis.
Yeah, exactly.
happen, yeah.
You know, so I feel like, I don't know, even like when we talked earlier, we talked about like there being different steps to the healthcare system. Like, I don't know if you want to talk
like
about.
when you're coming to
Yeah.
the clinic or something.
Yeah.
Yeah. I guess it's also different because in South Africa there's a lot more. I won't say a lot more. I don't know the statistics of Canada, but I know there's a lot of people who have diabetes, hypertension is also a big problem, and you know, of course, there's more cases of people who have HIV and tuberculosis, also very common. So there's obviously a huge push for prevention, just because there's already so much work that they have to do already for the people that have it. So like a day in the clinic, right? If you're coming to a clinic, at least the clinics I was at in Cape Town, what would happen is you go there, you go to the receptionist desks, you open up a folder, and they give you an appointment. But oftentimes, if you're really sick, sometimes they'll give you the day off. And usually you can get it the day off, and sometimes you can't. They ask you to come back for another day, for another appointment. There's usually a period of time, but I don't know now. It's been a few years since I've been in South Africa, but usually, you know, you go to the reception, you open a folder, you get an appointment. So if you're having an appointment on the day, they will send you to the preparation room. In the preparation room, you often find like an ENA, which is enrolled nurse assistant, which is like a PSW, and oftentimes, and also a practical nurse, right? So they will do the blood pressure. They'll check your blood pressure and your pulse, and then in another room, or sometimes the same room, if there's too many people, they will also check your urine, right? They'll do a urine dipstick for you. So they put all those results there, and then you'll go to another room where there's a practical nurse, and then they will check your HB, which is the number of red blood cells in your body, in your blood at the time, and also your glucose levels. And then they'll write that on the paper. And then they will either go see a nurse or a doctor, depending on how severe it is. You know, say for instance, you come in for a cough, you have a headache. So sometimes you'll see a registered nurse. They will do an assessment for you. And if it's not too bad, if they see that, okay, this is not so serious, they could give you over-the-counter medication. Like you can make a nursing diagnosis, you know, like maybe constipation or diarrhea or something. You know, they'll give you the over-the-counter medication and they'll send you home. Or if it's too bad and the nurse assesses that it's actually really difficult or a very serious illness, they will send you to the doctor's office, which is usually like next to it, right? And that will happen at the clinic. So that's how it works. Usually, you know, by the time you see the doctor or the nurse, you kind of have all of these baseline, assessments done for you.
Which is good. Like, that's
can see
proper
a picture.
client care.
Yeah, so that's how you start. Yeah. Here, when I went to the apple tree,
Oh my
yeah,
They
I
put you
was-
in a room for like an hour straight.
Yeah, and they ask you what's
The guy
wrong.
comes.
Yeah,
Lay there. Do the chest and you're
you're
gone.
done. I was surprised because I said, wow, this is a first world country. Maybe it's different. Maybe it's because of the system that I don't understand. I just know that that's usually what we do in South Africa because of those reasons, right? Because you never know who's going to walk in and what they have, you know? But yeah, that's...
It's crazy because when you think about what the world labeled third world or the real, they do have extremely great doctors. It's like maybe it's there's obviously low staff because education costs money, but once again, like when you're in front of a doctor over there, the care that you have, you can't compare this to Canada.
It's like a holistic care, and it's like it looks at the whole person, and like it takes the time to actually assess rather than like, okay, well, you're just a member, you're just coming in, here's their scans, okay, well, this says no, so then
They're real doctors.
They're
Here,
exactly.
they'll be like, oh, you need a cardiologist for that. I'm not I'm a
Yeah.
respirologist.
Yeah.
Oh, well, you need to go see the neurologist for that.
Yeah.
I'm a cardiologist, right? Like, they don't take the human as a whole picture, right? It's just parts here, parts here.
Yeah.
Parts
Oh,
here.
wow. They don't have like general, you know.
Oh, they definitely do, but
they'll refer you.
they'll refer you.
Yeah,
Right?
and I don't get that. You know how Cuba is, Cuba education is free. Everything, their system is like everything you want to study is free, and even to become a doctor. But unfortunately, doctors over there, due to being a communist country, doesn't get paid as much. So you get paid more to be anything related to tourism, to work in resort, because this is where you get tips and stuff. But the doctors over there, I forgot which article I was reading, but a lot of time when other countries need help, they do ask Cuba doctors for help. Even with COVID, when COVID was started, and they just and people and doctors in Cuba doesn't make it for money because they can't
Get the money.
they're not gonna become millionaire rich.
Incentive.
So it's just they do it because they're passionate about it and stuff, and I feel like the culture in Canada and the first world, it's all about money. It's capitalism. Everything is around money, and which is it ethic? I don't know, but
Most likely not. But we've made. Anyways, let me not talk about it.
yeah, because there was a time, I know a lot of people that have been sick for a while, like even me, like when I was a kid, I got sick for a long period of time, and every time I used to go to family doctor is a whole different thing. I understand they're not nurses, and I understand we're not talking about doctors, but just talk about the healthcare, like family doctors. This needs to be a whole another podcast, another episode, because I was sick, and every week me and my mom, we had to go back, and they couldn't find what I have. Finally, when my mom is just like, oh, we're going to like the hospital at this point because you can't figure out what's wrong with my daughter. And randomly he was like, oh, it was a bacteria. And at this point, I'm like, no, you just wanted us to come. You just wanted to like swipe my health card, even though it's for free, but like we still pay for it somehow. And I don't know. I just think that the entire time some people could, if my infection got to a point it got really bad, I could have died from this situation. But they never took me seriously. I was telling them how much pain I was, and they just, I'm just gonna give you Advil, and I'm like, no, sir, I'm in way much pain than that.
And that's very common for us in our communities, especially. Like I can say the same thing.
Pain is not taken seriously.
At all.
Yeah.
At all. At all.
No, that's even across the world in South Africa, because again, as great as, when coming to the clinic, they do all of these background checks, there's still some problems in healthcare in South Africa and in most places because, you know, sometimes you cannot get to everybody, and sometimes you undermine the person that's coming to you, you know, either because you're there as a check, because if you go to the private healthcare sector in South Africa, obviously you have to pay to be helped, so they won't care about you. And unlike maybe at the hospital where there's so many people who are sick, they just going to see the ones that are the most sick, and then the other people get left behind, you know. And that's why, like, it's crazy, like, it's so sad when you don't consider the pain of somebody, but at the same time, when there's so many people who need help and there's only so much one person can do, you're kind of stuck here, you know.
But then I think like that goes back into the prevention and starting very, very early on from like high school education, maybe even elementary education, where people need to learn more about their bodies and how it functions, and not your little anatomy of je sais pas quoi, you know what I mean? Like, and I feel like like we're not taught enough about our bodies until we're in a classroom that we have to take for like biology or something like that, you know what I mean? So I don't know if it really just has to start early on. It has to be a whole curriculum change from was it
But
bottom
you
to
mentioned
top?
a lot about clinics in South Africa. I find that that's something that we don't have very much here. Like lots of accessible clinics that you can just walk into and, you know, for non-major issues, right?
Yeah, I was surprised.
You know, we have big hospitals with everything, but we don't have those little clinics that you can just, other
I
than
feel like-
Apple Tree.
I was gonna say like we have those
Apple
clinics,
trees
but they're
one.
not like
They're not
useful. Or you go to like Orleans Urgent Care, the line is like super long.
But they're used,
you know?
our clinics are used more as a small urgent care, which
Yeah.
they should be used, like you said, more as a preventative. Oh, you have diabetes. Diabetes is something that can be handled in the community where you don't necessarily need a hospital for that, you know, like if you have high blood pressure, you know, like certain things that can be taken care of within the community and not necessarily, you don't need to go to Emerge because you have, you know, for, you know. So yeah,
These first world countries need to go and learn more from developing and third world countries.
Yeah, actually, I was
it's not
surprised
working.
to learn about that. So little walk-in clinics here. I assumed that they would be like in South Africa, but I was
We'll skip to the
surprised.
next.
I was surprised you guys don't even have day hospitals. I didn't know what day hospital. I didn't know that you didn't know what a day hospital.
well, we
is.
have, the day hospital is incorporated within the hospital.
Oh, so it's combined.
Yeah.
Okay. Yeah.
So it'll just be a section within the hospital, right? Like if you're,
Okay, because some of our day hospitals, they are also part of the main hospital. So there's the day hospital, there's a clinic, day hospital, and then there's the actual long-term care hospital, right?
Okay.
Sometimes the day hospitals are on their own, and then if it's more severe than that, they'll be transferred.
So when you need access to healthcare in South Africa, there's like you start off going to the clinic first,
Yes, most
and then
of
the the doctor there will assess you, and if you need to go to the hospital, then
You get
that's
transferred
transferred
there.
to there.
Yeah, or you can go straight to the hospital. Sometimes the hospital has a clinic connected to it, so you send there. Or if you go to emergency to the hospital, then you go.
Do you have
to
family
the hospital.
doctors?
So, family doctors, it's like, I don't know, it's not the same as here, right?
Because it sounds like the clinics kind of replace the family doctors.
In a way, yeah, because it's like day-to-day persons. Because I oftentimes, when I had a family doctor, it was the private doctor that I used to pay to see, because oftentimes if you go to the clinic and you wait like weeks for your blood results, and by the time you get the results, you could have gotten way worse, you know, because they will send you home and say, oh, we're waiting for your results. And by the time you come to the clinic, there's so many people, the waiting list is long, you might not get seen. Or sometimes you get seen and, you know, not enough information. So that's also a big problem. So that's the thing here. Like, I was surprised that I can't just pay a doctor to help and do everything and check everything. Like, oftentimes, say for instance, I have like a really, really bad like growth, right? Like, it's not like, I don't know what it is. And I went to the clinic and they said they're gonna send me to a doctor, but then the doctor's appointment is like
in 3 months.
weeks, months. I won't see them, and I don't know what this is. I can go to a general surgery see a doctor, pay a lot of money to see this one consultation, and they will manage it, right? Obviously to the level, and then or they can transfer you to a hospital, because of course if it's too bad they'll send you to the general hospital, and then they will do help for you, right? But then generally I would rather go see a doctor, pay that, and do
Yeah.
that. But here I don't know if you can really do that.
No, it's not
Yeah,
a thing.
it's not a thing.
No.
No,
That's
it's
crazy.
a free system.
Yeah, insurance.
Okay.
System.
Yeah.
So, next question. So, well, hopefully this could be a brief one. So, can you guys talk a bit about like your perception of racism within the nursing field or the healthcare field? So, how you either see it yourself, if you've experienced it, if it's at like a systemic level, the employee level, if it's within like the client, well, the patients, I would say. Yeah, like what is your perception of racism?
Well, there's definitely racism. We're not gonna
Not say it doesn't exist.
deny that.
Yeah.
But yeah, there's definitely racism coming from the client itself and up higher up, right? The staffing has changed quite a bit. Right now, like, I'm not sure about everywhere, but from what the small part that I'm in, there's a lot more immigrant nurses, right? So, like, as a whole, because I don't want to say that we are predominant, but the majority now at this point. Mm-hmm. But then you'll see, like, the white coworkers, they will have more that they will still have, the status over those nurses,
Okay.
right?
So they're like more in like supervision spaces.
Yes.
Okay.
So they will get more of those roles, and the Black or immigrants will have more staff nurses positions, right? And it will be very harder for them to move elsewhere. There's always some, other jobs or positions that are, preferable, right? So it's just, you won't see that, right? So I find that in that, there's always a status level, right?
Yeah.
So, yes, we let you become a nurse. We gave you a good paying job, but we want you to stay here, right? And we're going to keep these positions for certain people, right? And
do you see like the increase in immigrants like more for them to like fill in a quota, or is it actually because like they're trying to hire Black?
right now, there's just a need for nurses. There is no
Okay.
nurses. So there's
Yeah.
a number need to be filled. It needs to be filled.
It's quotas.
At this point, it's like,
Anyone
like,
available.
Yeah.
anyone available. Anyone.
But is that better?
And, and I think Canada changed their regulations. Maybe you can with their licensing, like transferable degrees. Because I think it was much harder, but since COVID, I think they loosened up things.
They had no choice.
So a lot of nurses are able to get, their license now, and the process is easier. I heard.
Yeah. I heard that I also like, because I'm a practical nursing student, they told us that now practical nurses are having more access to certain responsibilities that they didn't before.
Now they have full status quo, no difference of work.
Yeah.
Except the pay.
Except the
But
pay.
pay, of course. And also, they're also introducing maternity and postpartum care
That's
in
nice.
practical nursing, and apparently that was unheard of from before. And obviously, I'm just learning about this now, and they explaining the transition, and it's pretty interesting.
But I have a question for you, though. So in your nursing classes, do you see more immigrants in your classes, or is it mostly predominantly white?
We're getting
So,
into this.
yes.
We're getting into this topic.
I'm not gonna lie to you. Yeah, literally, I can say maybe 10% of my class are Canadian.
Yeah.
The rest of it, I think we're mostly immigrants. But again, I'm also doing programs. So I'm doing practical nursing at Perth, and a large majority of the students are international students.
Okay.
So of the international students, there's probably like 30 something of us. Of them, there's probably like maybe 7, 8 of us that are residents and citizens, and the rest are kind of like international students. So you see that a lot. So personally, I think that the schools, the places that we're being sent to work are not diverse at all. So, because I'm placed at Perth, right? And in the smaller, like a town of Perth, there's not a lot of diversity. Like when I went to work there, I said, hey, it's just me. Huh? And a lot of my students that I study with, a lot of them come from India. And then obviously there's a few other students from other places, but the majority of students are from India. And so when we go and we're placed at these different placements, oftentimes you will see that we're kind of the diversity of the kind of the hospital we're going to. So yeah, there's definitely a huge difference. Yeah, so I don't know. As for like racism, South Africa is still a very racist country. The apartheid ended in 1994. Some of us were born in that year. Some of us were alive in that time. You know, so there's still this huge shift in people's mindsets and in people's thoughts. So you like you said earlier, there's racism from the client and then from higher ups. So there's the patient and then there's people in power. You know, and obviously now, of course, the government is predominantly a black government. But even then, it doesn't change the biases that people have because of apartheid, right? So oftentimes you will see that you are undermined because maybe they will see someone with a different skin tone and think, oh, this person might know more, or they might undermine you. Because
I want that nurse.
Yeah.
That actually happened. Yeah. Many times. I even a student, this is in South Africa, where we were working at an MOU, which is maternity obstetric unit, which is a clinic, maternity clinic. And so there was a lady, we were, doing the vital signs for the checkups, and she saw my nursing student colleague, who's a white, this white student, and she saw the registered nurse coming to her who was about to assess her, and she said, no, I want her. And we tried to explain, this is a student, but she was like, really? I think that I would prefer her. But they didn't explain why. And the person who was saying this was not particularly a white person. There's a lot of ethnicities in South Africa, right? You have black people, and even black people. There's not just one type of black people. There's South African black people, and then there's, foreigners from other African countries. And then you have a specific ethnicity that's specific to South Africa, which are called colored people. That is the ethnicity.
Which is what?
Girl.
Colored.
I'll show you. Okay, I'm
Yes.
actually, because we just had a conversation about it. It took me.
I'm sorry.
You will be
it's
shocked.
A very
You will be
derogatory
shocked.
term here,
You will be
but
shocked.
that is the
We'll add a
actual
picture right there.
Let me.
Yeah, we'll add a picture. Okay. And there's a whole video. Anyways, we were having a
So
whole
there's-
conversation.
Is that the mixed kids?
So I don't know if you can see this. They're not mixed.
Yeah,
They're
mixed,
colored.
yes and no, but they actually, that's the ethnicity.
And you would think we would think that they're black.
Yeah, they would probably be calling black here.
But apparently, if you
it's
call
a
them
very-
black, it's insulting.
So
Because
what do we think?
depends.
Yeah, I don't want to.
Depends.
I don't want to get into this.
Grimaud.
Grimaud, Grimel.
C'est des Grimaud, c'est
Yeah,
Grimaud.
comme le métis.
Oui,
Yeah.
métis, ouais,
Yeah.
c'est
You
ça.
can say similar to that.
But it's interesting that
Yeah.
they're specifically called colored and they want to be called colored. And
That's their ethnicity.
Yeah.
So it's not even like they just woke up and
yeah.
I'm assuming they want to stay colored too.
I think
Yeah.
it's the actual ethnicity because of the way that people are classified because of apartheid, right? So that's their actual ethnicity, and so obviously there's that ethnicity, and then you get Indian people who are not colored. Obviously, the Indian, that's their ethnicity,
Yeah.
and then you get white people, of course, right? And so there's the
We
different.
have a lot of Indians.
Yes.
Yeah.
Yes, there's a lot of Indian people in South Africa who are South Africans, who the families are from there, but they also have, their origins from ancestry,
Yeah.
from India. So it's really a multiple of cultures, and so that is the type of ethnicity, and that particular person who said that was part of that ethnicity, colored person. And of course, this is something that you would see from anybody, right?
Yeah.
Obviously, Black people, you won't see that more often because it's the Black person is not common, right? And also depends on where you're working, which communities you're working in, because different communities don't all speak English, right? Yes, English is one of the most official languages in South Africa, but there are 11 official languages in South Africa. And within different communities, there's a main spoken language. Either they speak in Xhosa or Afrikaans or English. Obviously, the generally spoken language in hospital is English. The reports, everything is written in English. But obviously, when you're speaking to the patients, obviously it's important to have the language that people speak in the community. So obviously, you know, some people would prefer a lighter person if they're from certain ethnicities. But again, it's all because of the history and the biases that people have. I hope this is...
It's complex.
Yeah, it's complex. Thank you
Very
for teaching me something.
Yeah.
How can nurses be better supported?
Speaking about specifically Black nurses, I think mentoring, honestly, would be the best thing.
What kind of mentoring?
Not like mentoring as in like, teaching how to do skills level,
Yeah.
but mentoring as in opening your mind to the different possibilities,
Okay.
right?
Yeah.
Seeing what's out there, trying new things,
Yeah.
experiencing different things.
Yeah.
And just like continuing to grow and to level up,
Yeah.
right?
Yeah.
Like opening up a pathway, basically.
That's true what you say that, because a lot of the times I feel like the Black nurses stay within the same field and they're the same position for like the 30 years. When you have like new nurses who come in, they do their work for maybe a year or two, and then they
keep
do
growing,
and they
right?
do travel nursing, and they go around and they come back and they go in different fields and they experience different. Yeah.
So I really think that mentoring and opening up ways and doors and pathways for all the new nurses coming in would really be supportive, right?
I completely agree with her.
You're a student, so how do you want to be supported?
I need a mentor.
And I guess discussions like this, right?
Yeah, I really, because you need to understand what system you're going into, and you have to know what's going to happen once you are licensed, because it's one thing to be a nursing student. That's why I have to say I'm a nursing student from South Africa, because I was not having that responsibility as a registered nurse. That's a lot more pressure. And I unfortunately never got the opportunity to have that experience so I can contribute more. But I do know that mentorship is extremely important, as well as I don't know how possible it is, but some mental health support, because you're getting abused every single day. Whether it's because of your experiences, you're dealing with something that was really traumatic for anybody to experience, or whether it was some abuse from people you're getting, right? Like, for instance,
Like you mentioned, we're caretakers at work and at home in our communities. You know, Black women go through a lot, and that mental health is definitely I'm really happy you brought that up.
Yeah.
Because
And can you guys believe how, if we think about like, how do you call that? Generational trauma?
Yeah.
Do you know how long that
Yeah. We've been doing the same.
we've been doing the same job and we've been experiencing the same thing?
yeah, I can tell you, like, my aunts, both of them are nurses, and my grandmother was in the healthcare field as well. And they all wanted to do some other profession, right? My one aunt wanted to be an accountant. She did her bachelor's, she did her master's. This is in France. Never accepted for that. Went into nursing. That's the only way she was able to provide for my cousin.
Wow.
You know, same as my other auntie. They were not accepted for any other field, just nursing, because you are limited by that. Now, obviously, there's a little bit more space being made, but even then, sometimes it's to fill a quota. You know, not necessarily because of your qualifications, what you contribute. So, because you in their mind, you're filling a quota, you're only able to do a certain amount of things that they want you to do. So.
it's like, we gave you this.
It's good enough.
Yeah.
Continuous generation. Our children are gonna get it also, maybe.
Yeah.
Let's hope not.
So how do we break this cycle? You guys are doing a good job.
Thank you for this.
Thank you. This was a good
Thank you,
conversation.
thank you.
I was excited to see where this was going to go, because I know, like, for me, I think people I think I had tried to explore the idea of nursing, but
I
I knew
tried to.
very early on it wasn't for me.
I did one
just- I
class
can't- I
and
don't
I
know.
gave up.
I
So
did
you
the.
did do a class.
I did a class because I don't know. I was trying to make my mom proud,
See, there it is.
all just
there
trying to
it
make
is,
mama
there it
proud.
is.
and then
It's the truth.
and after that, I just started to talk about that class was autoimmune, this bacteria and virus class. I don't know
Immunization.
I don't. Yeah, something like that. And they started with the names, and I said no. I said no.
Nice
I said I refuse to
Yeah.
learn that. Like I told myself I'm not going to learn that. Like I
Yeah.
said,
It's a whole no.
good money or not good money, I can't. My brain cannot process this. Like,
And it would
so
have been like a traumatic experience if we would have
Oh.
put ourselves through that.
I
Yeah.
see blood and I faint. I cannot.
Yeah, I can't
I
work with like
cannot.
I don't know. I can't physically help people. I think I could do the mental part. I
I
can do the
remember
rest.
thinking
Yeah.
that
Yeah.
too, until
Yeah.
you. Sometimes you're in too deep. The fees have been paid. There's no going back.
That's true.
You have to
Yeah,
be
that's
strong. Because I mean,
Yeah.
you become you learn to become desensitized. You
Yeah.
know?
Yeah.
It's like anything. Like when you start staying on your own and paying your own bills and
Mm-hmm.
and taking care of yourself like you've never done it before. Now you're doing it. You know.
That's it.
Yeah.
Yeah. Well, this was a great episode.
Yeah.
Thank you.
Thank you.
I appreciate having a different perspective. I think that brought on a lot on our own gaps in our system. Like we knew we had some gaps, but I think it's important that like as a country, if we talk about inclusivity, we talk about diversity, the whole EDI stuff, and if we talk about, you know, wanting to grow as a nation and truth and reconciliation and all these different things, we want to be able to actually draw upon other communities and other countries and their models of systems, and knowing that like we're not the only ones who have a quote unquote good system, you know, and it's not as great as we would like it to be. So it's important that we listen, we learn from others, and that's how we grow as a nation, as a people, as a I don't know, power to the people. I don't know what else to
That's
say.
it.
You
To
know?
all my nurses, chapeau bas.
For real, for real.
You can follow me at _consciously black.
And you can follow me on Instagram at the thoughtful therapist _ And I don't know if our guests have any social medias or anything they want to share. Nah, we're good.
Unfortunately, not influencers.
Yeah. So thank you,
Not living that
Anicia.
influencer life. Not yet.
Thank you, Anicia. Thank you, Aurore. We appreciate y'all, and keep up the good work. You're
Thank
saving
you.
lives. And then we clap.